Welcome to the deep dive.
Hi there, good to be back.
So today we're tackling kind of a rare one, a condition in dogs and cats called lymphomatoid granulomatosis.
Right, LG. It's definitely something specialists encounter, but not your everyday diagnosis.
Exactly. We've got some pretty detailed medical info here, and our goal really is just to understand it better.
Makes sense.
Wow.
What it is, who gets it, the key things.
How it's diagnosed and what the outlook generally is.
Okay, let's dive in then. So, lymphomatoid granulomatosis, LG. It's essentially a disease where certain immune cells, atypical lymphoid cells, they just start multiplying uncontrollably.
Kind of going rogue.
That's a good way to put it, yeah. They go haywire. And they don't just multiply. They aggressively invade tissues, and they seem to really target the lungs.
Ah, okay. The lungs specifically.
That's the primary site, and what's really characteristic is how it affects the blood vessels in the lungs. It's called angiocentric.
Centered on the vessels.
Exactly. And angiodestructive, meaning it actually damages those small blood vessels.
And that damage must be a big part of the breathing problems you see.
Absolutely. It's a major factor contributing to the respiratory signs.
So who are we talking about here? Mostly dogs, or cats too.
It affects both, primarily dogs and cats. In dogs, the average age when it's diagnosed, it's around 5.75 years.
But there's a range, I imagine.
Oh, yeah, definitely. We've seen it diagnosed in dogs as young as 1.5, up to like 14 years old.
Any particular breeds more at risk?
There's no single breed that stands out statistically, but anecdotally maybe, it seems slightly more common in larger dogs and purebreds.
Okay. And gender? Any difference?
Doesn't seem to be, no. No known gender bias.
So for pet owners listening,
Mhm.
what might they actually notice? What are the sort of telltale signs?
Well, the signs usually develop progressively. They don't just appear overnight. And they're mainly respiratory.
Like a cough that lingers.
A persistent cough, yes. Difficulty breathing, which vets call dyspnea. Sometimes a clear runny nose. They might tire out really easily on walks, exercise intolerance, losing weight without trying, not eating well.
That's anorexia.
Right,
Yeah.
correct. And maybe a fever, about half of them might have a temperature.
And you said progressive. Over what kind of time frame?
It can develop fairly quickly sometimes, maybe over just days or perhaps a few weeks.
Okay, but those signs. A cough, trouble breathing. That sounds like it could be quite a few things. Pneumonia, maybe? How do vets sort it out? Sounds challenging.
It really, really can be. That's one of the big hurdles with LG. You have to rule out more common things first. Pneumonia, sure, even lung cancer or other unusual forms of lymphoma.
Do the usual blood tests help much?
Often, not significantly. Routine blood work, urine tests. They might come back looking surprisingly normal. Sometimes maybe you'll see a little bump in certain white blood cells, neutrophils, eosinophils, basophils.
But nothing you can hang your hat on.
Not reliably, no. And just to add another layer, some dogs diagnosed with LG might also have heartworm disease going on at the same time.
Oh, wow. Okay, that
Yeah.
complicates the picture.
It certainly can.
So what about looking inside? Imaging. X-rays.
X-rays are definitely a key step. They can show things like masses in the lungs, often in specific lobes. The lymph nodes in the chest area might look enlarged.
Huh.
You might also see fluid buildup around the lungs in the chest cavity. Can be on one side or both.
But even with those findings, it's still not a definite LG diagnosis.
Exactly. There's strong clues, suggestive findings, but not proof positive on their own.
So what is the definitive step? How do you get that confirmation?
The gold standard is a biopsy. You need an actual tissue sample from the affected lung.
Right.
And critically, it's not just looking at the cells under a microscope. You need special tests on that tissue, something called immunohistochemistry.
Ah, using markers to identify the cells.
Precisely. We use specific stains or tags that stick to certain markers on the cells. Common ones are CD3, CD20, CD79. This tells us exactly what type of lymphoid cell is causing the problem.
And what does it typically look like under the microscope, the histology?
You generally see these sheets, these collections of abnormal lymphoid cells, sometimes cells that look like plasma cells too, and they're often mixed with some inflammatory cells like eosinophils right within and around the blood vessels in the lung. That angiocentric pattern again.
That vascular connection seems key.
It really is. And sometimes, interestingly, you might even find cells that resemble Reed-Sternberg cells, which are characteristic of Hodgkin's lymphoma in people. Another little clue.
What about just looking at cells collected, say, from fluid? Cytology.
Cytology can be less helpful here. It might just show sterile inflammation, eosinophils, neutrophils, maybe some reactive macrophages, but often doesn't give you the definitive answer like the biopsy does.
Okay, diagnosis confirmed. Then what? Does LG tend to spread? And how does it treat it?
It does have the potential to spread beyond the lungs, yes. We can see it involve organs like the liver, heart, kidneys, spleen, pancreas, even adrenal glands sometimes.
So systemic treatment is needed then. Chemo.
Exactly. Chemotherapy is the mainstay of treatment. Usually involves combinations of different drugs. In some selected cases, surgery might be considered, perhaps if there's a single, large, accessible mass, but chemo is generally key.
And that sounds like something for a specialist.
Oh, absolutely. Working closely with a veterinary oncologist is really important to develop the best treatment strategy.
What kind of chemotherapy are we talking about?
Often, the protocols used are similar to those for other types of lymphoma. A common one is known as CHOP. It's an acronym for a combination of drugs. But it's important to note, there isn't one single standard protocol that's been systematically tested and proven best specifically for LG.
So oncologists adapt existing effective lymphoma treatments.
That's generally the approach, yes. Using drugs known to target these types of lymphoid cells.
Okay. During treatment, any particular complications or side effects owners should be watching for?
Yes, definitely. It's important to monitor them closely. Sometimes the breathing difficulties can actually worsen temporarily before they improve.
Oh, really? Okay.
And then you have the potential side effects common to many chemotherapies, maybe some lethargy or depression, reduced appetite, and importantly, effects on the bone marrow, which requires regular blood count checks.
Right. Standard chemo precautions.
Pretty much.
Which leads us to the big question, really. Prognosis.
Yeah.
What's the general outlook for pets diagnosed with LG?
Based on the reported studies, the median survival time for dogs that undergo systemic chemotherapy is around 12 months, so a year on average.
Okay, a median of a year.
And it's a really significant, but individual outcomes can vary quite widely. It really hinges on how well an individual pet responds to the chemotherapy.
And probably complicated by how difficult it was to get the diagnosis in the first place.
That likely plays a role too, yes. But that 12-month figure is specifically with treatment. The prognosis without chemotherapy is unfortunately much, much shorter.
So treatment, even with its challenges, makes a real difference.
It's currently the best approach we have to extend their quality of life significantly.
Okay, so let's just recap briefly. Lymphomatoid granulomatosis, rare serious lung condition in dogs and cats.
Right, caused by those rogue lymphoid cells attacking lung blood vessels.
Diagnosis is tough, needs that detailed biopsy with special stains. Treatment relies on chemo, often borrowed from lymphoma protocols.
And the prognosis is guarded, typically around a year, median survival with chemo, but very individual.
It really underscores the complexity, doesn't it? Both diagnosing and treating these less common conditions. Which makes you wonder, and this is maybe a final thought for you, the listener, given this rarity and complexity, what further questions might this raise about the links between maybe genetics, environment, and the triggering of such specific immune-related diseases in our pets?
It's definitely an area with more questions than answers sometimes.
Something to mull over. Thanks for taking this deep dive with us today.